West Nile virus by Nile, Sophia Osman, and Chris Suda. Biology of the pathogen. The virus is a single-stranded, positive-sense RNA sequence. It is translated as a single protein. It begins its life cycle when it enters through the cell membrane. From there, viral RNA enters the cell cytoplasm. Once released in the cell, the RNA is replicated and translated into proteins. The viral RNA is replicated by both cellular and viral proteins and exits the cell in order to infect other cells, thus spreading the virus. Birds are the natural hosts of West Nile, and the virus is transmitted to humans through mosquitoes that feed off of infected birds. The virus is most common in Africa, Europe, the Middle East, North America, and West Asia. Outbreak sites are on major bird migratory routes.
West Nile virus is transmitted when a mosquito bites an infected bird, which then bites a healthy bird. The bird and mosquito make up the primary transmission cycle. However, the mosquito can also bite dead-end hosts, such as humans or other animals. 4 out of 5 infected humans are asymptomatic. However, about a fifth develop flu-like symptoms, while less than 1% become seriously ill. The mosquito-transmitted disease belongs to the same family as Japanese encephalitis and dengue fever. Its virus has a smooth protein surface that contains a nucleocapsid, which encases a single strand of RNA. The virus travels to and attacks the central nervous system, where it dumps its RNA into a host cell. Symptomatic patients suffer fever, headache, nausea, vomiting, and skin rashes on the chest, stomach, and back. However, if the virus breaks the blood-brain barrier and infects the brain, more serious symptoms may occur, including encephalitis, high fever, headache, vision loss, muscle weakness, or even death. To prevent infection, avoid going out at dusk or dawn, and wear long sleeves and mosquito repellent when outdoors.
The West Nile virus is most commonly transmitted to humans by the bite of mosquitoes. In small cases, people can be infected through blood transfusions, organ transplants, exposure in a laboratory setting, and through pregnancy, delivery, breastfeeding, etc. Among humans, people over the age of 50 are at a much higher risk to develop symptoms of West Nile virus. People who spend much of their time outdoors during the summer months in humid regions also raise the risk of infection. Around the world, the West Nile virus is most commonly found in Africa, the Middle East, North America, and West Asia. In all these locations, West Nile virus is at a high in humid and wet conditions that support mosquito growth and proliferation. Statistics. From 1999 to 2013, there have been 39,557 cases of West Nile virus reported by the CDC, with only 1,668 deaths in that time span, about 4%. Early, no symptoms. About 80% of people who are infected with West Nile virus have no symptoms when first bitten and will typically not show any symptoms. Mid, milder symptoms. Up to about 20% of people who are infected with West Nile virus will have symptoms after being bitten, which include a fever, headache, body ache, nausea, vomiting, swollenness of the lymph glands, and rashes on the chest, back, and stomach. Late, serious symptoms. Only about 1 in 150 people infected with the West Nile virus will develop the harsh and severe impacts of the disease. Symptoms after having the virus for a long period of time include high fever, headache, neck stiffness, disorientation, stupor, coma, tremors, convulsions, muscle weakness, vision loss, numbness, and paralysis. These symptoms can last up to several weeks, and the neurological effects can be permanent.
Birds are the natural host of West Nile virus, which is transmitted through a mosquito bite. This is how it is kept in the cycle of nature. But horses, humans, and other mammals can be affected if bitten as well. West Nile virus is assumed to duplicate and then disperse to lymph nodes in the bloodstream. Viral proliferation of the central nervous system follows stimulation of toll-like receptors, which increases porosity of the blood-brain barrier. West Nile virus directly infects neurons, especially in deep nuclei and gray matter of the brain, brainstem, and the spinal cord. Destruction of nerve cells may contribute to paralysis. Immune-mediated tissue damage may also contribute to pathologic changes in some cases. The virus can very easily spread in areas that are heavily impacted by mosquitoes and infected humans or mammals. Diagnosis can be accomplished by testing serum or cerebrospinal fluid to detect West Nile virus antibodies. Also, plaque reduction neutralization tests performed in reference laboratories can help determine the specific infecting flavivirus. No vaccine or specific antiviral treatments for West Nile virus infection are available. Over-the-counter pain relievers can be used to reduce fever and relieve some symptoms. In severe cases, patients often need to be hospitalized to receive supportive treatment such as IV fluids, pain medication, and nursing care. Long-term prognosis effects of West Nile virus include tremors, meningitis, and cognitive disorders. These may occur in more than one-third of patients with confirmed infections.